factors, I'm just going to talk about two. One is that you may not know about the exotic animal trade, and you may not know that you can buy a primate just up the road in Macon, Missouri. Exotic animals are traded around the world. And because of policies existing in Missouri, Missouri is actually a location for the regional trade of exotic animals, putting human beings at risk and also decimating the ecological ecosystems from whence those animals come. The other is wildlife, the destruction of wildlife habitats. Human beings are expanding their communities and agriculture, living, hunting into previously wild environments. And when you think about, we talked a lot about what drives human behavior. When you think about some of the factors that drive human behavior that would cause a community to encroach on wild land, the hunt for food, for other sources of livelihood, then you come up to a second very, very strong trend pattern that is clearly illustrated by the way that the Ebola epidemic has been unfolding. And that is the existence of health inequity and health disparities. One of the strongest patterns, when you look at populations globally, across countries and within countries, one of the strongest patterns you see is that health outcomes, how long you live, whether or not you get sick, are closely correlated to socioeconomic factors. How much money you have, how much education you have, whether you're socially isolated, whether you're subject to discrimination. And this is true for infectious disease, but it's also true for non-infectious conditions, heart disease. And I believe it might have been Corinne, one of our panelists this morning or earlier, was talking about how when folks are stressed, the amount of information, new information, that they can incorporate into their behavior is limited. And health information is changing. Today, it might be Ebola is the threat. Tomorrow, it may be a different infectious disease with a different transmission route. But the information is always changing, and the degree to which you can act on that information is determined by your social, economic, educational related circumstances. And so health outcomes, there's something called a socioeconomic gradient in health, which is that a stair-step pattern to health outcomes that is correlated with these factors. There are enormous disparities between countries when you think about the United States and the West African countries that have been hardest hit by Ebola. And you think about how health disparities on a country level are manifest in things like health infrastructure and other kinds of infrastructure. And then there are also disparities within countries, including our own. And one of our panelists is going to talk about the health disparities in the country. Now, obviously, health disparities and health inequity hurts those at the bottom of the gradient the hardest. But when you want to consider what the challenges are with controlling and preventing infectious diseases, think of how much more difficult that is for everybody if a significant proportion of your population cannot access medical care if they feel ill. So in that way you can see how the health inequities put everyone at risk. So two other factors that Ebola has really illustrated for us. One is that Ebola is a health crisis, clearly, but it's not just a health crisis. It's an economic crisis. It's an education crisis. It's a communication crisis. And it requires people working not just across disciplines, but across sectors effectively. And at the very highest levels, because it's a global crisis. But one lesson that in public health and in other disciplines, I think also, that we keep learning and having to learn, unfortunately, over and over again, and was repeated this morning, is that though solutions will be made or broken on the community level. And the successes in turning around rates of transmission in Ebola are attributable primarily to community mobilization. infrastructure is necessary and the control and surveillance is required, but the prevention efforts have happened when communities have been mobilized. And one of the issues, I kept thinking, writing notes in the earlier panel, this issue of sustainability. When you look at an approach that remains fairly consistent, regardless of whether you're talking about this epidemic or that situation, you're looking at capacity building that is in place and remains in place, a capacity to respond to a threat, even as the threat changes. So in those places where community organizations were strong, they might have been mobilized around maternal mortality issues or vaccination. But you have community leaders, you have community governance, you have communication structures, you have community health workers that are trusted by community members. Investment in those institutions is sustaining and will create a sustainable infrastructure that when your next challenge comes along, those are the units that you employ. So finally, public health is often discussed or referred to as an art and a science. And the science is the evidence base upon which you base your decisions. But often it's the art, it's the community mobilization that seems like the really hard part. The effective collaboration. And we discussed this panel before today. We talked about what would be our call to action. And I also wanted to respond to the question about how do we educate students so that they're competent and equipped for collaboration and for interdisciplinary work. And I would say that there are two things. One is, there are a number of things, but two things I'd like to highlight. One is there has to be a certain amount of self-reflection in the educational process. So as you're learning your discipline, you're also learning what kinds of biases come with your discipline. So that when you engage with others from a different perspective, you have some awareness of the biases that you're bringing to the table. And the other thing is that you learn what the strengths that your discipline is bringing to the table. What are the things that you know about that your approach that is not necessarily present? You have to know that, know what you're bringing in both cases, both positively and negatively to the table. So my final call to action before we move on is to start speaking out. And by out, I don't just mean loudly, and I don't mean just talking to each other about what ought to be done, but speaking out to policymakers, community stakeholders, to people in other disciplines and in other sectors. And one of the things we really do try to focus, I think, is a key component of interdisciplinary training is the ability to represent the knowledge base of your discipline succinctly, clearly, and accessibly to a variety of audiences, including